And we're doing J, which is the one that you see above it. Okay, good. J.
Yep.
So that basically sets the angle. Hey everybody, Dr. Todd from Gonstead Spinal Wellness. We are doing a traction training today. I'm gonna tell you that if you have an increased thoracic curve, if you have what's called a thoracic hyperkyphosis, I'm gonna show you one of the #1 things that you need to do, you must do to fix this, alongside some other things, but we're gonna show you today traction. All right, so when I say traction, it's really spine remodeling traction. It's not what a lot of you think of, which is what's called axial distraction that just pulls up on the head or pulls up on the body. This is curve correction. This is trying to bend the spine into a corrected position. So we're doing a staff training here on Friday, and Dr. Zach's actually taking over right now. He's going through this, and he's helping a newer staff member learn how to set someone up in a basic type of traction. There's a lot of specifics that we dial in as the doctor because every patient's a little different. We get the coordinates off the x-ray to know exactly how to put them in the equipment to get the best results possible. But we're going through some of the basics so that our team understand how to set someone up and how to take them out. Our patients are usually in traction for about 15 to 20 minutes per session. It's done over the course of a few months. And then we actually take another set of x-rays. So we have pre and post x-rays to measure how much curve correction has taken place to then determine what the patient needs to do from that point forward. So before we get started and I jump over here, if you haven't already, subscribe to our channel, comment below, let us know what else you want to see if you have any questions about what we're covering here today. And share this with others. Share this with someone you know out there that has poor posture and maybe they're a candidate for spine remodeling traction. You'll see some info on the page of how to get a hold of us to come in as a patient, to have us check you out, see if you're a candidate for care. If you don't live in Idaho or you're too far away to fly in and see us like some patients do, reach out to us, put it in the comment section. We'll try to find someone in your area that handles these types of techniques to be able to help you at least get checked out and, like I said, see if you're a candidate for this type of care. So we also serve two audiences. Last thing I'll say, two audiences: patients, people who want to learn how to stay healthy for a lifetime, also chiropractors. We teach chiropractors how to put functional movement in their practice, really. This is one of 3 things that we do in this clinic, where we address the segmental issues with the patient, the postural issues, and the movement. This is our exercise department over here. This is the thing that we teach other chiropractors primarily, is the functional movement aspect of things that happens in this exercise area. But today we're talking about the importance of traction and training, and we'll jump over here and meet with the crew in just a second. Okay, so in a few minutes, we're gonna go through the traction setup for this type of patient x-ray. So this is a thoracic hyperkyphosis. There's too much curve in the mid-back. This green line right here shows the ideal alignment that this person should have based on the height of their spine. Okay, so it's not just some arbitrary line that's thrown up there. This is specific to this individual. And you can see there's a green line and a red line. The red line is the patient. So that red line, the patient, should be on the green line or slightly in front of it, not behind it like this. And if you look at the shape here, there's too much curve. The measurement up here shows us where we're at. Ideally in the mid-back, there should be about a 44, so a mid 40 degree curve going forward. And there's almost a 62 degree curve. It's a 40% gain over normal. That pushes the head forward. That causes too much curve in the mid-back. And that's what gives us that hunched, slouched type of presentation. That's where the traction, we're going to aim at reversing that, at trying to flatten out the mid-back, taking out that curve, bending this out, holding the patient in that position for 15 to 20 minutes repetitiously to remodel deep ligament, disc, deep muscle, all those supporting structures that have essentially remodeled into that abnormal position. So that is why traction is of utmost importance in trying to get to the root cause of the problem with this. You can have too much curve like this. That can cause pain, it can cause poor posture, it can cause breathing problems because it closes down the lungs, the heart. If you look at the research, the peer-reviewed research, a thoracic hyperkyphosis, too much curve in the mid-back, there is more research correlating that type of abnormal posture with reduced health outcomes, even a decreased life expectancy. So this is a very important thing to, one, identify, with our patients, and then 2, have methods that actually work that are based on peer-reviewed evidence as far as how to reduce this, how to fix this, and how to teach a patient how to then do things on their own for the rest of their life, to have this on their radar, to continue to reduce this. This is not something that typically fixes in a couple of weeks. In about a 3-month period of time, we can get a measurable change, and then we have a gauge on how the patient's going to progress over the course of several months, a year, many years, so that they can move forward on the quest of aiming to continue to reduce this and then maintain a good, healthy, upright posture. All right, so Helena is going to go through and be our patient for the setup. So this patient of ours, the way it looks is they're seated. Conveniently enough, this is a patient that we filmed him getting adjusted the other day, and he's okay with us putting him on camera. This is what you have to think about a little bit. You have to know a little bit of the why. You can't just be a robot and just do it, but I won't spend a ton on the why. Traction is used to remodel the shape of the spine into a healthier position. Okay, so the spine can deform and get in bad positions, and you can do as much exercise in the world that you want to do. It's not going to change it. You can adjust a segment in the spine as much as you want, like from a chiropractic standpoint. It's not going to change it. You need to physically put someone in a corrected position, past a corrected position, and hold them there for 15 to 20 minutes to get ligament and deep muscle to remodel, to have a permanent change. And so in this case, his posture, he's hyperkyphotic, so too much curve. If someone's like this, that's one issue. Some people can be like this and like this. That's 2 issues. That's when you'd have a block in there. It's something that will come with time, and you can understand that in more detail later, but that's why some people have a block and some people don't have a block. It's a slightly different thing we're trying to accomplish, okay? So, but in this case, this is just a straight thoracic hyperkyphosis, too much curve in the mid-back, and we're trying to flatten this out and control the spine to do what's called 3-point bending. 3-point bending is point number 1, point number 2, point number 3, bends, like that, okay? That's what traction is a lot of the times, is 3-point bending with a human. Okay, right? You are the human. So you want to go ahead and have a seat, and then have you ever set anyone up in traction yet?
A couple of times.
A couple of times.
He was doing it this morning.
Oh, you were? Okay, cool.
I was practicing this morning.
Oh, perfect. Okay, so then this setup, let's start setting it up. Okay, so the first thing that you're doing is you're strapping the ASIS, which is the top of the pelvis. And that's because when we start pulling this forward, if you don't do that, she's going to pull right out of the chair. And then a key thing that we do is we always tell someone to scoot their bottom all the way back as far as they can go, because they will have a tendency to start to creep forward if we don't do that.
Nope, and then pull this super tight. You can pull it from the front. Patients are used to it. They're okay with it. Pull it tight.
And if you're like how Brandy was when she would set people up in traction, she'd be like,
I've totally done that.
you do that too? Okay.
Well, I only do it sometimes.
She would always laugh about it. She's like,
Sorry, I'm in your bubble.
she like straddles the patient, but which, hey, however, if everyone's cool with it. And then the shoulder strap thing
Goes on like a backpack.
goes on like a backpack, yep. And then as you put it on, and you've probably already heard this, but the thing that can happen is it can slide off the shoulders.
You're putting that wrong. The metal piece has to be at the top.
Oh yeah, that's right.
There you go.
Thank you for telling me that.
And then backpack.
Like a backpack.
Is that pretty good positioning?
Yep. But you're missing one thing to be able to make that pull.
To make what pull?
He's got a thoracic pull.
Which is
I hung a strap right here.
this one. That's right.
That pole right there. J.
And I have hooked
And it's
these
J
up to the
because-
blue strap before. Slide that over here.
H.
This one's cervical, this one's thoracic.
Oh, this one's cervical. All right. And we're doing J, which is the one that you see above it. Okay,
Now we
good.
can hook these up.
J.
Yep.
So that basically sets the angle so that we know what angle it's going to be pulling. In some cases, we pull slightly up. if we're trying to pull it forward and almost distract and elevate the spine. In most cases for thoracic, we're pulling straight forward.
Tighten the blue strap first. I was showing her a trick to make sure the strap, to help prevent the strap.
A secret to tightening this makes it a lot easier is watch, hold that for a sec. So here's the easiest way to tighten this, is you hold both sides of it.
Both sides of it, okay.
Yeah, so see I'm like holding two straps of it. And then, so it's like as long as you hold two parts and pull, it makes it way easier. If not, you're like chasing around a circle the whole time.
Okay, pull tighter.
Yeah. Is it starting to get snug? Okay, and then,
You can do that. Yeah, that right there helps prevent this from coming off the shoulder, I have noticed with patients. This is a trick Brandy taught me.
as far as what?
Push it all the way up, it helps prevent it from sliding off the shoulders.
Yeah, that little, yeah.
Yeah.
And guess where she learned that trick?
Probably you.
Yes.
There's one.
Because if you can clip it behind and not have to do it in front, then you don't have to worry about the strap choking them.
Yeah.
Which originally on these harnesses, you'll see a little strap that is hanging off the side.
Yeah, that one.
We seldom use them because they tend to ride up and then get close to choking someone.
Oh, okay.
Yeah, you don't want to choke people.
No. Okay,
Okay, that's it.
that's good.
Yeah, that's it.
Is that already tight?
Yeah, my back hurts today.
Gotcha.
That's it.
And just a side note, we're doing this for demonstration purposes, but usually patients are adjusted first, and when they get adjusted and they're doing warm-up exercises and they're more limber, then when they get in this,
I've already been adjusted.
it's more doable.
We adjusted today.
Okay, fine.
C6 was super swollen.
Fine, so she's screwed up today and can't do a whole lot of traction, but for the record, normally,
Yes.
okay, yeah.
And slowly release.
We're good. That's loose.
Yeah. You will get a read on patients. Some people actually do need it to come off that slow when it's really tight.
Some people like it fast.
And in some cases, even what you do is you take it off a little bit, wait like 10 seconds, and then go a little bit more and wait. Like some people, if they're really sensitive to it, you basically decrease the load like 10 or 20%. You take it off a little bit, let them get used to it. Okay, good. A little more. Some people, if you let them out too fast, it's way too intense for them.
Hurts. Okay. Good to know. Yeah.
Cool. So this setup can be done with a combination cervical as well, which about half the time you're going to see that. So it'll be what you just did with Helena plus something with the head and neck. Yep, with this one. Sometimes it's just pulling them straight up to try to elongate the spine and prevent them from doing this. If they already have a forward head translation, if their head's already shifted forward, it's something that the doctor will make the call to say, let's control the head and neck so it doesn't go more forward. And sometimes on the card, you'll see like keep C2 in line with C7. It's really, like, it kind of goes without saying. It just means that you don't ever want to see someone in traction or put in a position in traction that something else is going to get screwed up worse in the process of fixing the thing we want to fix. So that's the trick in traction is this process making something else worse? And sometimes we have to control that other area so it's not worse. So thoracic hyperkyphosis, a lot of these people that have too much curve are forward. Not always, but a lot of times it's a normal pattern. So when we pull this forward, the head's usually still stuck out here. We have to pull this up. And in some cases we pull this up and we do a two-way traction with it as well, which means two-way just means there's two angles, there's two forces.
Okay.
One is pulling the head up and back, the other one is pulling the neck forward to induce a curve. And that's where that forward strap would be used. Okay, there you have it. We brought you into our clinic behind the scenes. You got to watch how we go through a staff training with our team, refining some newer team member skills as far as understanding traction. We went through and explained an x-ray to you. We explained how we apply this to a patient. We didn't get into the exercises or the adjustment on this one. We'll have future videos with that. So make sure, if you haven't already, subscribe to our channel so you can stay in the loop. You can watch the upcoming series that will reflect back to this episode that you just watched right now. Comment below, let us know what else you want to see. And if you know anyone else that would benefit from this, please share this with them. Remember, we serve two audiences. One is for our patients and the public that just wants good information so they can live a long, happy, and healthy life. And we also serve chiropractors. We teach chiropractors how to put functional movement and corrective exercise into their chiropractic practice. With that said, this is Dr. Todd from Gonstead Spinal Wellness. When it comes to the health of you and your family, results matter most.